Hi, Katelyn. Thank you for coming in today. Can you tell me what's been going on with you lately?
Yeah, so I've had a really bad cough for a couple of weeks with lots of phlegm that just won't seem to go away. It seems like every couple of weeks I tend to get a sinus infection. No matter how much I eat, I can't seem to gain any weight. And me and my husband, we've gone to see a fertility specialist because we've been trying to get pregnant and it hasn't worked yet. So after telling her about some of my symptoms, she encouraged me to come in and see you.
Okay. I'm going to ask you some more questions and do an assessment.
Okay.
And we'll go from there. Okay, so I'm going to send you for some tests, and then I'll see you back in a few weeks, and we will go from there.
Okay, thank you.
Katelyn, thank you for coming back. Let's discuss some of your results from your tests.
Okay.
Your results indicated that you have cystic fibrosis. So to diagnose cystic fibrosis, patients must exhibit at least one symptom of the disease, which we will discuss later, and or they must have a sibling with cystic fibrosis and or a positive neonatal screening test, as well as a test to determine if the patient has a faulty gene which codes for cystic fibrosis. The first test a doctor will perform is a sweat test. Due to a faulty gene, the patient's sweat will have elevated levels of chloride. Providers will measure the amount of chloride in the patient's sweat, and a normal patient's skin will have under 29 millimoles per liter of chloride. Levels over 60 millimoles per liter of chloride on 2 consecutive measurements in one day can indicate a possible diagnosis of cystic fibrosis. Levels between 30 and 59 require further testing. The next test a doctor will perform includes a genetic analysis. In this exam, a simple lab draw is completed and the patient's DNA is examined. For this test to be positive for cystic fibrosis, mutations must be identified. Finally, if previous testing is inconclusive, electrophysiological tests which examine the mucosa in the rectum or the nose are done. To learn more about cystic fibrosis, I'm going to send you over to our cystic fibrosis expert, Billy Bob Irwin.
Crikey! This right here's a bona fide cystic fibrosis gene. Don't these little buggers look so kind and sweet? But don't let them fool you. These aren't the nice jeans your daddy said you got from him, and they sure as hell ain't the blue jeans the country songs write about. These genes here cause a major problem. These genes cause a condition called cystic fibrosis. Cystic fibrosis is a condition which affects the secretory glands, like in your sweat, or mucus glands in your lungs, and the digestive tract. This faulty set of genes causes abnormally thick mucus to build up in your body. This prevents your lungs, pancreas, and other digestive organs to not function appropriately. Some respiratory symptoms that patients may exhibit include a chronic persistent cough, wheezing, a shortness of breath, or even frequent sinus or respiratory infections. Some GI symptoms patients may have include greasy and bulky poops, the frequent or difficult bowel movements, constipation, nausea, swollen abdomen, poor weight gain, and growth. And sometimes may actually experience type 1 diabetes. Fortunately, you can only get these faulty recessive genes if both your mama and your daddy have them. Now where to go? Hang on now. For more information on handling wild old cystic fibrosis here, I'm gonna send you over to my expert in exacerbations while I deal with this. Come here, you!
Good luck with your hunt, Billy Bob. Now, what I'm here to talk to you about is if one of these vicious creatures attack, and how cystic fibrosis might behave if it comes into contact with these infections. There are many things that can cause complications for a patient with cystic fibrosis. And if you or a loved one start to experience any of the following symptoms, please contact a provider or go to the ER. Symptoms of a worsening condition include an increased cough, weight loss, an increase or change in the color or thickness of sputum, and decreased lung function or an increase in the work of breathing, please, again, contact a provider or go to the ER. Now, in order to avoid these exacerbations, patients with cystic fibrosis should do 5 things. 1. Comply with the medication and therapy schedule as prescribed. This can include multiple medications and different types of therapies, such as chest physiotherapy or other exercises. 2. Eat a high-fat, high-calorie diet. Due to the buildup of mucus in the GI tract, absorption of food can be decreased. So it's important to increase fat and calorie consumption to increase the amount that is being absorbed by the gut. 3. Begin taking fat-soluble vitamins such as A, D, E, and K. These supplements are especially necessary for patients who have thickened mucus in their GI tract. 4. Take pancreatic enzymes with every snack and meal. The enzymes help the body with digestion, so food can more easily be absorbed. And 5. Finally, perform aerobic exercise. Aerobic exercises like walking, cycling, running, or swimming can help clear the airways. Now, treatment for cystic fibrosis is unique to each individual and should be discussed with their provider.
All right, so let me just go over some of the treatment options so that I make sure that I understand what's going on. Currently, there's no cure for cystic fibrosis. However, there is treatment options that are going to help minimize my symptoms. Some medications that I can take include antibiotics, mucus thinners, bronchodilators, steroids, stool softeners, and pancreatic enzymes. The antibiotics, which are in pill or IV form for worsening exacerbation of my cystic fibrosis, are used to treat the infection, which tend to grow in the thicker mucus areas. But I must make sure that I finish all of the antibiotics so that the infection doesn't get worse. If I take the antibiotics, I should also avoid drinking alcohol and use another method of birth control until my antibiotics have been completed. I could be placed on mucus thinners such as Diagnose alpha, I think you said, which helps to break down the mucus and makes it easier for it to be excreted. Bronchodilators also help to relax my airway and will help to make it easier for me to breathe. The steroids, those are usually used to treat inflammation that's usually caused by the infection. I could also be placed on a stool softener because my body's inability to absorb nutrients in my GI tract and will help me from accruing a blockage. Pancreatic enzymes such as pancreolipase can also help to digest my food, and I must make sure that I take it before I eat any meals or snacks to make sure that it's effective. There's been some newer medication you were talking about that help to treat some of the cystic fibrosis. A newer discovered medication used to treat symptoms of cystic fibrosis is the Cystic Fibrosis transmembrane conductance regulator modulator. This helps to keep my mucus thin and to be easier secreted. It's the modulator that usually helps to correct the mutated gene that causes cystic fibrosis. Some treatments that I could also use that aren't medications include airway clearance techniques, oxygen therapy, and certain surgeries. The airway clearance techniques are the vest therapy or percussion. Surgeries which can help include nasal surgery, which will help to improve the airway passage, and I can also get a feeding tube if it comes down to it and I'm not getting enough nutrition. If there is an intestinal blockage, then there is a chance that I would have to go through a bowel surgery to relieve it. Lung transplants may also be another treatment option for severe cases. The treatment options are different depending on the severity of the cystic fibrosis and the symptoms that I am experiencing.
Katelyn, it sounds like you did a really great job listening, and I will be with you through this whole journey.
Thank you. I appreciate you.
That was like a career option at one point. Like,
Test and find out what we can find out, okay?
Thank you. I'll see
Find
you in a
out
couple
what we
weeks.
Can you tell me what's been bothering you lately?
Yeah, so
Wait.
I'm ready.
Your sister. We had a lot of fun. Okay, we gotta start over.
some of the cystic fibrosis.
Fibrosis.